it's Dr. Desai, and it's Reporting Live with Dr. Desai on this Tuesday, February 27th, 2024. I want to use today's episode to comment about primary progressive aphasia and dementia. We may have seen in the news that Wendy Williams was recently diagnosed with this, and this is what they put out as her working diagnoses. Wish her well on her own personal journey, but taking a step back just from a medical knowledge and educating ourselves, what really is primary progressive aphasia? So think about it like this. If somebody you're around or yourself may have trouble with their speech, meaning trouble finding words, trouble getting their points across, saying things that may not be understandable, or saying words out of order, and it kind of feels like, well, that's a one-off, maybe it's something, and they correct themselves, but then it happens again in a short time after that, and you're noticing these patterns. It's something we need to think about. Sometimes for ourselves and our loved ones and people we're around often, it's very easy to think, oh, it's just a one-off, they're tired today, let's move on to something else. Remember, it's important to take a step back and think about what it could be. So primary progressive aphasia is speech difficulty that is progressive. It starts very slow onset and then steadily gets worse over time. That's why it's really important to try to catch this early. So if you think you have a friend or loved one or even yourself who's having this difficulty, first, talk to your primary care physician. There's neurologic testing, there's specific testing that can be done. Treatment options may be more limited right now, but in the terms of knowing a diagnosis and knowing early, maybe speech therapy and some other proactive things can be done. Dementia is a whole nother topic, and the big thing in the message I want to get across are the subtle signs of dementia that we sometimes miss. Dementia thinks about things that present for ourselves that we may be leading towards a dementia diagnosis is short-term memory issues. So things you remember long-term are there, but over time, progressive short-term memory issues are going. If we think that's happening, whether you're in the younger middle-age bracket or older bracket, think of dementia as a possibility. There are neuropsychiatric and neuropsychologic testing that can be done for that, and that takes several hours, but it's the right steps to take if we're starting to have those, because for dementia prevention, we do have medications that theoretically can slow things down. They're not always a right fit for everyone, but it's worthwhile to explore from a diagnosis standpoint. In terms of what we can do to prevent dementia, the biggest thing we can do is stimulate that brain. Think of the brain as an organ, a muscle that needs a lot of stimulation. So that means exercise, that means keeping it stimulated with crossword puzzles, reading, critical thinking, socialization. That's huge. Some of our retired patients that we have, they're very isolated. Socialization, that executive functioning, jogging that mind to do its work will really help. Primary progressive aphasia, dementia, they're on those categories of what we are talking about, and we really have ways to identify them earlier to help identify, diagnose, and potentially treat. Wishing Wendy Williams the best on her recovery and next steps. Feel free to leave any comments or questions. This is Reporting Live with Dr. Desai.